Hello, everybody. Welcome back to Medical Myths, the show about what not to do with your body. And today I'm really frustrated and angry, and there's a reason why we're talking about this fake medical board issue today. And I've got into this in a little bit of detail previously, every time we've brought up certain alternative medicine and complementary and alternative medicine organizations. But there's one in particular that really made me angry this week. And before we get into that one, we're going to start off by talking about the one that was the most requested of me, and that is Rand Paul and the issues with the American Board of Ophthalmology. As of course, there was that whole thing during that election time about, is Rand Paul board certified? Is he not? Did he start his own ophthalmology board? And there's a lot that goes on into that, and it kind of brought up the question of what is board certification and why does this matter? Why do I care if my doctor is board certified, if they have experience and if they have the education? Why do we need this extra step? And it's a very good question to ask, and it's a very important thing to discuss. So when you go through medical training, there are multiple steps that will get you to a board certified specialist in whatever field you're in. So you're going to, at least in the United States, you're going to go through an undergraduate degree, which is usually 4 years. And then after that, you'll apply to medical school, which once you start that, that is 2 years of preclinical work in medical school, and then 2 years of clinical years, adding up to a total of 4 years in medical school, followed by a residency, which is between 3 and 7 years. And then after that, you might have a fellowship for a subspecialty, and then you'd become an attending. So, where does the boards fit into this? So, when you start medical school, you go through your first 2 years of preclinical studies, so studying all of the textbook learning, and then you take a board exam. And this is not it's not the same thing as a specialty board. That's different. So this is just the general licensing board to become a doctor. You have step 1 and step 2, which are both done in medical school. Step 1 is done after your second year, step 2 is done after your third year, and then step 3 of your medical licensing board is done after your intern year of residency. So upon completion of a medical degree and completion of all 3 of those step exams, you get a medical license to practice as a medical doctor. And then upon completion of your residency in whatever specialty that you do, you go through your specialty board. And this is where that comes in. So if you are an ophthalmologist, you're going to go through your residency as an ophthalmologist. And then upon completion, you can sit for the American Board of Ophthalmology board exam, which I think most specialty boards have a written component and an oral component. I'm not sure exactly what ophthalmology entails with that, but you sit for that board and then you are board certified. And then the requirements, most boards require you to stay certified. And after 10 years, you have to redo your board certification. And this is where Rand Paul was angry with the American Board of Ophthalmology, because right around when he was practicing, they had made the decision to add this requirement that now you have to redo your boards after 10 years. And this does a couple things. So, primarily, it enforces that everyone who is certified within the board of that specialty is up to date on the most current data, right? I wouldn't want to go see a surgeon, especially an eye surgeon, who is not up to date on the newest treatments and the newest surgeries. I want to make sure that this surgeon knows what they're doing and that they're being safe and they're meeting the up to date regulations for how to best practice surgery. So they added this requirement, and it's great. I think it's important that we verify that surgeons and other physicians are up to date on their practice. But Rand Paul was frustrated that the older generations of surgeons were not required to sit for the exam again after that 10-year period. And so he started his own ophthalmology board. And I kind of agree with him to the extent that you should have to recertify. I don't see a good reason why the older surgeons um, didn't have to do that. Why they were just grandfathered in. I don't agree with that. But he decided to because he was angry with the ophthalmology board, and basically he wasn't mad that they weren't taking it. He was mad that he also had to take it. So he just didn't want to take the repeat exam. And so he started this whole new board, which I have a lot of questions there. So if the board of ophthalmology is there to promote safety and appropriate education, this new board, what standards does it have? How do we know that Rand Paul is up to date on his uh, on his education as an ophthalmologist? And not being board certified doesn't mean that you can't practice, but it does mean that you're limited in terms of what insurances will work with you, what hospitals will work with you and credential you. It makes a difference for getting a job, because more often than not, if you are not board certified with your specialty, you are not getting a job. So can Rand Paul practice legally as an ophthalmologist without this board certification? Yes. It is a bit more complicated. Yes, he is still able to practice, but it should throw up some red flags that if someone is practicing without the board certification, why? Are they not up to date on their credentials? Are they not interested in being regulated? It kind of makes you wonder why they're not certified. So that's kind of the big thing with Rand Paul. But going into other areas of this board certification, I've noticed that there are a lot of pseudoscientific organizations, namely chiropractors, are who we're going to talk about today. But naturopaths also have their boards. Acupuncturists have their boards. Traditional Chinese medicine has theirs. And this idea of board certification, which is supposed to be reassuring to the public that my professional knows what they're doing and they meet a certain level of merit, is now being used as a lobbying technique to get more scope of practice for these alternative medicine practitioners. And it's being used to mislead the public into thinking that these people have greater qualifications than they do. So this all started how chiropractors, and I hear this argument frequently, is that, well, if my chiropractor is just staying within their scope, if they're just doing musculoskeletal treatment and that's it, are they really the problem? And here's the issue, is that many of these people, they want the authority and they want the respect, they want the scope, they want to say that they do the cool things that doctors do, but they don't want the accountability. They don't want to be held responsible when it goes wrong. So you'll see these people making claims that they can do all the same things as a doctor, but then when you push them on it, they start to back off because they'll put up their disclaimers of I am not a medical doctor. Go talk to your medical doctor about this. So they're not willing to face the responsibility for if their claims are bullshit, in all honesty. So what happened was you had these chiropractic boards and naturopaths and et cetera, who said, I'm only going to practice within the scope that is appropriate. So it's okay. So don't worry about it. People like what we do. People are satisfied with the care that I bring. So you should give us status as a medical practitioner, an alternative medicine practitioner. And so then politics says, okay, I can see that you just have interest in doing this thing. That's fine. You can practice. And then they inch forward and they keep lobbying. They throw a lot of money and say, well, but how different is it actually? How different from a medical doctor are we? We can diagnose, and they'll say this loosely. They can diagnose your musculoskeletal pain. Therefore, we're diagnosticians. I can use x-rays. So I'm the same as a medical doctor. I can prescribe supplements. So I'm the same. I took an anatomy class once. So I'm the same. I took a physiology class. I studied disease. So we're the same thing. And so they keep inching forward, trying to gain more ground and more credibility for what they do. And this is the problem, because now they start adding certain titles and removing others. And just when you're about to say, but wait, you said that you were only going to stay within this scope. You're way past the point now. And now they have this whole range of things that they can do that they previously were not allowed to. And they don't face the consequences because if you define a chiropractor as someone that uses musculoskeletal techniques, if you take them to court, by definition, they shouldn't know beyond that. So they're not going to be held to the same standard by a prosecutor because, oh, well, they just didn't know. They were operating in their scope and they just went a little bit beyond it and they didn't know what harm it had. Whereas if a licensed physician makes a mistake with a patient, they're going to be chewed out because they should have met the standard. Doctor, you should have met that standard and you didn't. I don't care that you didn't know any better in that particular case because you should have known because you are a doctor. So the language that we use matters. And what really bugged me this week is the misleading of something called chiropractic internists. And this is where the language gets really sketchy because you have these people that are lobbying that say, well, we should be allowed to say that we're doctors because we have a doctorate degree. I went through a 4-year doctorate program. I should have the title of doctor. So then it starts off saying that chiropractors can say that they're doctors, but they have to specify that they are chiropractic doctors or doctors of chiropractic. But then you see advertising where they will just call themselves, like on YouTube, they'll call themselves Dr. Blank, like Dr. Josh Axe. And many people will just assume that he's a medical doctor because he doesn't have to specify verbally because he specified in text, oh, well, I'm a chiropractor. So then they skirt the line even more. And they say, well, I want to use the term chiropractic physician. So now they're borrowing a term physician because they claim that they can be diagnosticians. So that must mean that they can call themselves physicians as long as they use the qualifier of chiropractic physician. But how many chiropractors do you think are specifying that clearly to where people understand that they are not a medical physician? Not many people would recognize the difference between that. Many people would think that chiropractors have the same education as a medical doctor. But there's this board that comes around, the American Board of Chiropractic Internists. And I'm going to go over with you real quickly what an internist is. So an internist is an internal medicine physician. They have either an MD or a DO degree in the United States. In some other countries, they might have an MBBS, etc. Whatever their licensed medical degree is in those countries, you have to be a licensed doctor before you become an internal medicine physician. This is a specialty. And yes, they are largely generalists at first, and many of them will go on to get subspecialties in things like cardiology, immunology, sorry, I'm like all over the place, gastroenterology, endocrinology, infectious disease. Those are all subspecialties of internal medicine. And how you get to be an internal medicine physician, you get an undergrad degree, you go to medical school, you take all 3 steps of those licensing boards, you go through a 3-year internal medicine residency, and you take the internal medicine specialty boards through the American Board of Internal Medicine. So they delineate that here. Exactly what are the requirements for this board certification? And that, and you take the internal medicine boards and you get board certified as an internal medicine physician. So to be admitted to the ABIM internal medicine certification examination, so to even take the exam at all, physicians, noting medical physicians, must have satisfactorily completed by August 31st of the year of examination, 36 calendar months. So 36 months. So we're talking 3 years, including vacation time of U.S. or Canadian graduate medical education accredited by the ACGME. So they have to be an accredited residency program, and they have to be in for 3 years, or they can be going through a residency through the Royal College of Physicians and Surgeons of Canada, or the equivalent in Quebec. So you have to be regulated by one of these, have to go through a residency program. Residency or research experience occurring before the completion of the requirements for the MD or DO degree cannot be credited towards requirements for certification. So you cannot count anything that was done in medical school. It has to be during residency. So this designates this as a completely separate time frame from your medical school. So they cannot overlap. The 36 months of accredited internal medicine residency training must be reported at 12-month intervals according to the clinical competence requirement training tables. No credit is granted for unsatisfactory training that requires repetition of a year at the same level or for administrative work as a chief medical resident. In addition, training as a subspecialty fellow cannot be credited toward fulfilling the internal medicine training requirements. All right, so going through this. So training and procedure requirements to be an internist. Minimum months of training, 36, and 30 of these months must be clinical. So 6 of these months could be research-based, could be public health-based probably, but 30 of them have to be clinical months. And procedures. Procedures are essential to internal medicine training. To be eligible for certification, all residents must perform procedures during training. Not all residents need to perform all procedures, so you don't have to perform every single procedure available to you, but you have to perform some procedures. Program directors must attest to general competence in procedures at the end of training. At the completion of training, residents must have demonstrated effective consent discussions, standard or universal precautions, establishment of sterile field, and application of local anesthetic as applicable to most procedures a resident may perform. Residents must have the opportunity to develop competence in procedures which will further their development as fellows in their chosen subspecialty or as independent practitioners in their intended fields if entering practice after residency. So content of training, they go further into, they have to meet these 30 months of trainings of clinical training in general internal medicine, subspecialty internal medicine, and emergency medicine. Up to 4 months of the 30 months may include training areas related to primary care, such as neurology, dermatology, office gynecology, or office orthopedics. So all of these months are clinically based. They are rigorous. We're talking 80 hours a week average. And a lot of residency programs are kind of skirting the line for not reporting being under the 80-hour a week limit. But that's a significant amount of time. That is double a full-time job for this very rigorous education. And at the same time, you're doing research, you're doing didactic education, you're teaching residents below you. So you're doing a lot. To meet board eligibility for an internal medicine physician is a lot. It is a lot of work, and you can be confident that if you have an internal medicine physician, you can be confident that they are going to do a good job and they are going to meet the standards as set by the ABIM, and they are going to be up to date on their training. And the question Grimbeard said, isn't everything but dermatology internal? And I know this is sarcastic, but it's basically internal medicine is primarily hospital-based. Most internal medicine residency is done in the hospital, but a lot of people go into outpatient subspecialties as well. But basically, this is adult medicine. That's what this means. So internal medicine cannot practice pediatrics. They cannot practice OBGYN. So they are not gynecologists. They will not do that. They will consult gynecology to deliver babies. They don't do that. They don't really do dermatology. They don't do surgery. So it's just, this is adult medicine. Oh, and they don't really do psychiatry either. So those are kind of the big differences, especially if we're talking the differences between internal medicine and family medicine. Family medicine has OB, has psych, has derm, whereas internal medicine, and it has pediatrics, and internal medicine does not. So this is only adult medicine. And you'll see where the chiropractic board is skirting this line as well, and they're not even meeting what the definition of internal medicine is. They have a very weird definition, and you'll see where they're skirting that line. But this is what an internist is. All right. Let's look at this other organization of the American Board of Chiropractic Internists. So what does it take to be a chiropractic internist? So let's look at their eligibility to sit for this exam. You must have successful completion of a 30-hour DABCI program, or you started a DABCI program class after the 5th trimester of chiropractic college. So with this, you can start during chiropractic school, whereas the ABIM has you do completely separate hours. You have to do a whole separate timeline. Adding on to this, holds a current chiropractic license, passage of all DABCI program module examinations, and then you have to pass the ABCI practical and pass the NBCE written examination. So they're trying to make this seem like a legitimate qualification. But let's compare some of these hours really quick. So they're claiming to be internists, and they only required 300 hours of the DABCI program, which doesn't even specify if those are clinical hours or didactic hours, online education hours, etc. 300 hours is not a lot. Let's factor in the 80-hour weeks for over 365 days for 3 years. So here we end up around, for an internist, for all of that time, and I guess including the medical school clinicals, which don't factor into this, and at least don't factor into the actual board certification for internists. But an internal medicine physician graduates residency with over 15, somewhere between 15,000 and 20,000 clinical hours, which is significantly more than 300 hours of a program. So let's take 15,000 hours. That's 50 times the amount of education in internal medicine that an internist is going to have versus this chiropractic internist. So who are you going to trust to be an internist? Not these people. I would absolutely not trust them at all. And especially if they're regulated by chiropractors who have no idea what it means to be an internist. So having this organization define what qualifies somebody to be an internist when they have no education to be an internist, like, what the fuck are your regulations? What the fuck are your qualifications? You don't even know. Your board doesn't even know what your qualifications are to be an internist. And I wanted to look at, there's a whole statement going over what is a diplomate, whatever the fuck, I don't know how to pronounce it, of the American Board of Chiropractic Internists, because it's not a board certification. I guess kind of is. It's just like a diploma education. It's not even a graduate level educational school or residency. But I'm going to share their statement on what this is and what this means for someone who practices this. So tell me, I want you all to tell me if you think this is, tell me if you think that they are trying to sound like physicians, or do you think that they're reasonably staying in their lane? I don't think they're staying in their lane, but you tell me if I'm wrong. Simply, oh, here we go. I can zoom in a little bit. Simply put, chiropractic internists are doctors with the tools and training to diagnose a wide spectrum of conditions, along with an education to use natural treatment options. So based on that first statement, it sounds like they're saying that these are chiropractors who can do medical treatment like a physician, like a medical doctor, and also have extra training in natural treatment options. Well, we already looked at their qualifications, and they don't do any extra training. They do 50 times less training than a board certified internal medicine physician. So that's not true. And they're using very vague language like a wide spectrum of conditions. Okay, cool. That tells me nothing. Absolutely nothing. In an era where more and more people have become concerned about the adverse reactions of prescription and over-the-counter medications, DABCIs are becoming a popular alternative. So appeal to popularity fallacy here. So because people like us, we're legitimate. And because people don't want to go see a medical doctor and they're concerned about adverse reactions, that means that chiropractic is legitimate and you should come use us as an internal medicine practitioner instead of conventional Western medicine. Which, yeah, there are adverse reactions of prescriptions and over the counter medications, but that's honesty. Anyone that is a chiropractor or a naturopath that says that there are no adverse reactions to naturopathic medicine or chiropractic treatment is lying to you, because there absolutely are. Anyone that has seen the case reports of vertebral artery dissections, which actually this was a question on my medical licensing board, was a patient that comes in uh, who had neck manipulation done, had a vertebral artery dissection, and didn't notice until 3 days later because it can be a slow bleed. And then you don't know that this came from the chiropractor. But there are risks to anything that you do with your body. There are risks to eating a ham sandwich because you could choke on it. Anybody that says anything done with your body is risk free is lying to you. But they get away with these arguments. And I'm getting absolutely fired up because legislators are the ones making decisions about which one of these boards can be seen as legitimate. And they get to decide who gets to use these titles of internist, cardiologist, neurologist. Legislators make that decision and they don't know medicine. So if you have somebody that's a pseudoscientist grifter that's going to show up to a Senate House or a representative house and say, I do the same thing and patients like me, legislators don't know the difference between these chiropractors and internists. And part of this, I do think, is like the fault of the medical doctors and their medical boards, because they're letting these people get away with this. We need to speak up more about this fraudulent activity. This should not be. This should not be as widely accepted as it is. And they go on more to say every year, more and more patients are choosing DABCIs as the first doctor they visit when they get sick or are having health problems. So basically, they're admitting that people are being lied to, that chiropractors are lying to patients, and that patients like what chiropractors are doing. So they keep coming back and choose them as the number one. What happens? What happens when you have a patient that has no idea the limitations of chiropractic? Like, let's say someone has an autoimmune disease that can have serious consequences. Like, I don't think people understand how dangerous lupus is. Lupus can affect your cardiovascular system. It affects your renal system. You can go into end stage renal disease and require dialysis from a lupus flare up. And people, let's say somebody's feeling sick and they say, I'm scared of what the side effects are for conventional medicine. So I'm going to go see a chiropractor. And if they're going to adjust this person or whatever, and they don't have, even if they try to diagnose this person, they don't have the ability to diagnose somebody with lupus. They don't have the knowledge, and they're going to insert themselves and say, I am competent enough to handle this. And this is absolute Dunning fucking Kruger of these people. Because delay in getting dialysis for somebody in end stage renal disease can kill them. This is not benign. These statements are not benign. And what this sounds like to me, all of this sounds like to me people who want to be doctors but don't want to do the work. They don't want the work and they don't want the responsibility. And something here too is like, and Purple, I'm gonna go about this. Like, even if a chiropractor is trained at chiropractic, there's a lot of problems. Number one, with the things that chiropractors are trained to do, that the treatments they use are not legitimate. They're placebo at best. And the things, because I know Purple and I talked about this in a chat. The treatments that are legitimate done by chiropractors are not exclusive to to chiropractic. They're done by physical therapy, massage therapy, and DOs. But those aren't the go-to techniques. Those are not the bread and butter of chiropractic. The bread and butter of chiropractic is absolute bullshit. And I want to address this too. Like, just because a chiropractor is with a university does not mean that they're legitimate. And there is a problem with this lobbying. You have traditional Chinese medicine that is being promoted by some universities. You have naturopaths being promoted by some universities under the label, under the banner of integrative medicine. But it doesn't make the practice any more legitimate. The way that came out was because these alternative medicine practitioners lobbied, saying this is discrimination if you don't treat our specialty as an option. And so going with this thing, trying not to be discriminatory, they've allowed universities, which are run by administrators, not by physicians, have allowed this to be present at the university, but they're not legitimate therapies. And honestly, I think having chiropractors at a university is discrediting a lot of these universities. I think that's not a good move on their part, because it's not discrimination to regulate fields based on merit. And chiropractic and naturopathy have not demonstrated merit. So it's not discrimination to say you can't practice your specialty as a physician at our university because it's not been shown to have merit. So yeah, I like today's whole episode is basically my soapbox about everything wrong with the lobbying of chiropractors, but it's very scary. Yeah, and HR, I would agree, go with PT. PT is demonstrated to be probably the most safe option you can use. But here they go on to say, and because DABCIs are trained not only in medical diagnostics, but also utilize more alternative cutting-edge testing and natural treatment plans. So they're saying not only are they trained in medical diagnostics, which they're using these terms intentionally because there's no concrete definition that says this is the practice done by a medical doctor. So if they said trained in medicine, they could be held accountable because the field of medicine is the field practiced by medical doctors. That is protected. So medical diagnostics is a way to imply that they practice medicine, but not be liable if someone were to sue them on the basis of fraudulent advertising. So not only are they qualified and trained to practice medical diagnostics, but they also do this extra thing. They are the cutting edge of medicine with their natural treatment plans. These alternative practitioners find themselves evaluating and successfully treating those patients deemed by the medical community as challenging or even hopeless. And this was something that I stressed to Twitter the other day, and I got some interesting feedback on this. But I had asked the question, what is a condition that is simultaneously so medically complex that can also be treated by throwing supplements at it or throwing a chiropractic treatment at it? By definition, medical complexity requires, let me pull up the actual definition, medical complexity definition. So the accepted definition this is by the American Academy of Pediatrics, says that medical complexity is conceptually regarded as a combination of multi-organ system involvement from chronic health conditions, functional limitations, ongoing use of medical technology, and high resource need/use. So thinking of medical conditions that have all of these, or at least components of them, a multi-organ system involvement from chronic health conditions, functional limitations, ongoing use of medical technology, and high resource need or use. Does that sound like you could just throw supplements at that and be good? No. By definition, these are contradictory. You cannot simultaneously have something that is medically complex and treatable by throwing supplements at it. So they are basing these statements on the public not knowing what complexity is. They'll see this as a medical doctor might say, I don't know what caused your condition. I don't know the actual diagnosis. I don't know what treatment will help this. And so alternative medicine practitioners swoop in and they say, I've got it. These people gave you an I don't know answer, which is probably the most honest answer they can give, because we don't know everything. Medical science doesn't have all of the answers. And it takes humility and honesty for a doctor to say, hey, I've looked through everything that I know, and I don't have an answer for you right now. I'm going to keep looking. I'm going to send you to somebody else who might know an answer that I don't because I'm limited. And that's an honest approach. And I understand why people would be frustrated. I can empathize with somebody that has a chronic, very highly complex illness that doesn't have an answer right now, and they just want relief. They just want somebody to give them some improvement. I get that that is a driving motivator for a lot of people to pursue alternative medicine, but it's absolutely disgusting that these chiropractors and naturopaths and homeopaths step in and they take advantage of vulnerable people who don't have an answer right now and say, I have an answer. These people don't have an answer, and I have an answer, and it's popping your back and giving you supplements. And they can say this because you can't prove it wrong. And this is an argument that we see a lot from religious arguments. We hear this from all kinds of pseudoscience. We hear this from flat earth. We hear this from others is you can't prove me wrong, therefore I'm right. And that's what they're doing here. You've been treated as challenging or hopeless, and that's not possible because I have an answer and you can't prove it wrong. So I can sell you snake oil. And they're saying, how is that possible? It's the approach, a time-honored method of doing the detective work in addition to using diet and nutrition to replace dysfunction and illness with normal body function and health. Yeah, and Grimbeard makes a point. We can prove them wrong, and we have, but our proving them wrong has not stood up against their money and their lobbying because you pay a lot of money to see these people. And these chiropractic boards are very if they're good at one thing, it's convincing people that they're legitimate, and they're very, very, very good at lobbying. And unfortunately, the AMA and other medical organizations are not. They are not good at lobbying because they've spent a lot of time learning medicine and understanding the ins and outs of the nuance of medicine, but unfortunately, it has left less time for learning how to lobby to politicians. So we need to work on that, and we need more. We need more physicians in politics that can stand up to this. Yeah, feelings don't care about facts. Exactly. But again, like looking back at the requirements for to become a chiropractic internist, how would these people even know what it means to diagnostically test and find out why is this happening? You don't have even close to the education to determine that. 300 hours doesn't even scratch the surface. Even the limited undergraduate level, which no joke, the chiropractic education is undergraduate level biology at best, cannot teach you enough to be a practicing internist. It can't. There's a reason why we go through a rigorous medical degree program and residency. Chiropractors do not do residency. How in the hell? How in the hell would they be able to diagnostically justify anything? It's horrifying to me. And I'm somebody about to enter my residency. I've done probably 5,000 clinical hours already just in medical school, not even counting my experience as an EMT doing 911 before that. I'm not prepared to diagnose these people. I'm not ready yet. And I know that because I know how much more there is to know. And these chiropractors, they just don't know what they don't know. and they're ready to put themselves into a situation where they're diagnosing somebody with DKA, which is what an actual internist would be prepared to manage DKA. That's actually something I'm prepared. I'm prepared to manage DKA, and I'm a fourth year med student. Um, I don't think these people know what they're getting into when they say that they can do this stuff. The unfortunate choices for many have been go to their family doctor and do or take what their doctor orders. Yeah, how dare people go to a family doctor who has a 4-year medical degree, 4-year undergrad degree, a 4-year medical degree, a 3-year residency program, and possibly a subspecialty fellowship. How dare somebody go to somebody with actual education and listen to what they say from their experience? They should just go to a chiropractor with 50 times less the education, which I didn't even notice that was 50 times less. That is an insanely small amount of education. Go online and attempt to self-diagnose their problem. Order a supplement they saw advertised on the television, or ask a friend, usually one that's involved in an MLM, who sells supplements. Which, yeah, you shouldn't self-diagnose. You shouldn't go to your TV and order supplements. You shouldn't ask your friend who's in an MLM. Like, these options are ridiculous. Obviously, they're trying to equate. They're trying to equate option one here, the go to your family doctor. They're equating that with the other three awful options of self-diagnosis, order a supplement, and MLM. Like, why are we putting these on the same page? And for any legitimate medical practitioner or medical organization, if you are legitimate, you should have the data in your own field to just say, hey, we're legitimate. Here's what we can do. Here's the evidence that we have. They don't need to put down like their whole credibility as chiropractors is shitting on MDs and DOs. Like, the basis for all of their arguments is rooted in shitting on medical doctors. They don't ever justify why they're legitimate. They don't demonstrate their merit. They just say, we're fine, take us seriously because they're bad. And that doesn't prove your point. That doesn't prove that what you're doing is legitimate. Like, even I'm not going to say for 1 second that there's no problems in medicine. There absolutely are plenty of problems. But just because this organization has problems doesn't mean that another organization is better just because they're not the first organization that we talked about. Like, you need merit beyond that. And these people don't have it. Many medical treatment protocols don't hold water when viewed with this holistic and restorative care mindset. Give data. If you're going to say, so this is a demonstrable claim. Many medical treatment protocols don't hold water compared to holistic and restorative care mindset. So what you need to do, give me a citation, because this has the ability to be tested. And in fact, they have been. We have studies that suggest that the holistic and restorative care is bullshit. It's not demonstrated to work. And I think if they had the data that proved that their points were legitimate, they would cite them. I think organizations that have legitimacy don't need to hide the studies, because they can say, hey, we have the data. Here's this study that suggests that what we're doing is legitimate. Here's this other study that suggests, here's this other study. But when the chiropractic board suggests that they have legitimacy, they don't share any of their sources. I wonder why. I wonder why they wouldn't want to cite the studies that suggest that holistic care is superior to conventional medical protocols. And the reasons why they say it's better is because inflammation is not something to just get rid of, but rather it implies some dysfunction that needs to be evaluated or treated. And I've gone into whole videos about this. So you can go watch those videos. Watch my video on homeopathy, watch mine about terrain theory. That's probably the best one to look at, is the inflammation versus germs debate, which really isn't a debate. Like, yeah, inflammation is legitimate, but is inflammation the root cause of every single disease? No. No, it's not. And is inflammation an implication that you're exposed to toxins? No. You could have an autoimmune disease, which is just a sign that your body hates you. And it's not anything that's your fault. It's not even necessarily an environmental cause. It might be, but it might not be. And to just lazily, so and again, for people that are suggesting that they're detectives and that they can find the root cause when medical doctors can't, it seems awfully lazy to just chalk it up to inflammation. Like, yeah, it's easy to be a detective and diagnose everybody with things if you can just go through your mental algorithm and pattern and say everything everything is caused by inflammation. So when somebody else doesn't have an answer, I can just swoop in and say it's the inflammation. Did my brain do any work for that? No, it didn't. It didn't at all. But I can pretend that I did it, detective work. And I think part of this too results from people don't understand what goes into medical diagnosis. It's not an algorithm. It's not I see symptom as a list of symptoms, lump them all together, and then boom, pattern seeking. I align things in my brain, algorithm. It's this diagnosis. It's not that easy. It's not that black and white. It's very, very gray. And there's why when you watch the show House, which House is not a perfect show, but I will use it for this example, like why they're writing things on the board and why there's so many overlapping patterns. And it's easy, or it's not easy to diagnose. It is easy to just lump it in as a pattern. But this is why it takes so long to be a doctor, because in medical training, you have to turn off our instincts. You have to turn off the brain's desire for less cognitive resistance. You have to turn off intuition, which is very difficult to do. And it takes time to develop that. Because you're going from a place of a false security of I know this pattern, I've seen it before, which can be dangerous. Like sometimes you can rely on patterns, and a key thing is knowing when to utilize the pattern and when not to. Like for example, in cardiac arrest, it's a very high stress environment. That somebody has gone down and you need to resuscitate them. We have a pattern that works uh, the best most of the time. And so in order to mitigate stress, you might need to fall back on the pattern and fall back on experience of I've seen this before. I can calm myself down and go through this pattern. And more than likely, they're going to have their best chance at survival. But let's talk about cases where it's not that easy. There's one I like to use frequently where, let's say, somebody comes in with abdominal pain. Um, that's kind of broad, right? But what are some causes of abdominal pain? You could have appendicitis. You could have an ectopic pregnancy. You could have some viral infection of your intestines. You could have a urinary tract infection. You could have multiple different things. And if somebody, let's say somebody has appendicitis, like, yeah, we need to intervene pretty quickly. Um, but let's say, we are waiting to get the OR ready to do this appendectomy. Someone comes in with that abdominal pain. I'm convinced right off the bat, I'm just going to say, yeah, appendicitis, this beats the pattern. Let's go. Um, it might not be. Oftentimes there's a condition that overlaps completely with appendicitis in the way it presents, which is inferior mesenteric ischemia or superior mesenteric ischemia. One of the mesenteric vessels is occluded by a blood clot. If you get a blood clot in your intestines, it can kill you within 24 hours. And here's the scary thing about it. It provides pain beyond proportion. So someone seems okay. they seem like they're not having an emergency. So if this person just had some like really bad abdominal pain and they don't know why, there's this seemingly healthy person, they go to their chiropractor because their chiropractor said that they can diagnose these conditions, and they say, "Oh yeah, no, your vitals are fine, um, all your tests are fine, you can go home." No, they cannot, because the pain out of proportion should be a red flag that, hey, they might have a blood clot in their intestines. We need to intervene right now. And the intuition in that case could misdiagnose that person and could kill them. I've also seen like, and this is a case for an internist uh, told me. A critical care internist was giving a lecture to me and another med student about mucormycosis. This is a great and scary example. Mucormycosis is a fungus. It's a fungal infection. Often that affects diabetics, and it's very aggressive. And the prognosis is miserable. Um, people die within days. And if you treat it, basically the treatment is surgery. Take it all out. Um, and it often gives people very disfiguring surgeries. Like if you get mucormycosis in your face, you have to remove parts of your skull, and it just stays open because you can't. It's really difficult to repair that. Um, you have to remove limbs. You'd have to remove parts of your body. It's very disfiguring, and you're still probably going to die. If you take off a part of somebody's face because they have this fungal infection, they're still probably dying, even if you take it out. It's really, really dangerous. But if you catch it early enough, you might be able to give them more time. You might even be able to get rid of the fungus entirely. So, this critical care physician said that he saw this lady in her 30s or 40s, so kind of a younger person that you'd see at the hospital. And she came in with a band aid on her chest. Or she had this kind of dark spot on her chest. And always look under the band-aid, because sometimes this shows up as a scab and people think it's just a scab, but it's actually mucormycosis and you might be dying. So this lady comes in with this discoloration on her chest. She gets a mammogram and was told it's not cancer, but was told it said in the path report that it was mucormycosis, but she thought she was fine because uh, she was just listening to the "it's not cancer" part and didn't understand mucormycosis. But this one little spot on her chest was metastatic and very aggressive. And when they finally got a second scan, because she ended up presenting to the emergency department uh, in the ICU like hours or days later with difficulty breathing. And they get a scan, a CT or an MRI scan of her chest, and it had metastasized to behind her sternum. So now it was in her chest cavity. And she was up and walking and feeling mostly okay apart from that. But basically, the physician told her, like, hey, you're going to die in a few days. And the lady said, okay, thanks for telling me I'd rather die at home than in the hospital. So she goes home and she dies at home a few days later. But this is a great example of where not knowing what you don't know can kill people. Look under that band-aid. But also, if you're a chiropractor that saw the band-aid and just said, hey, this is a scab, you're fine. You don't need to go to the hospital. It'll heal up soon. And then someone dies. These people are not prepared for that. They're not ready to handle that responsibility. They don't know any better. And I kind of empathize for the chiropractors like who get into this honestly believing that they're going to help somebody, and then are scammed into a career of lying to people and lobbying to just for responsibility that they're not prepared for. I empathize with that, but also it's absolutely disgusting, and they should not have these schools to begin with. That was a long tangent about inflammation and why diagnosis isn't simple. Oh, and they say heartburn and reflux are not valid diagnoses, which like I'll I kind of can go with them a little bit on this, because they say to the answer is not to stop the body from secreting acid and causing symptoms. To a DABCI, the important answers are to the questions: why is the stomach inflamed? What caused the ulcer? Why is the stomach allowing acid to back up into the esophagus? Which I will grant them is a good question. However, I think that they're not on the same page with an actual internist about what this means. Because yeah, if I was in the hospital setting, um, I would be probably yelled at by my attending if I said that their chief complaint was, or that the primary diagnosis was reflux, because they would say reflux secondary to what, or what secondary to what. It would probably be like, as we wouldn't just say that reflux was a diagnosis. We'd end up saying like they have a gastrointestinal ulcer secondary to H. pylori, etc. Like usually we'd say if there's a symptom that's kind of the main thing, that's related to something else, we'll say blank secondary to blank. And so that's how we write it. However, I think that's not where they're going with this. They're saying, why is the stomach inflamed? Trying to address the toxins in the body and the unnatural state of the body and whatever, which is not the way that we would say it. Like when we're saying we're looking for the root cause of why the stomach inflamed, like are we talking eosinophilic issues? Are we talking a cancerous issue? Are we talking a zebra stomach disease? We're talking H. pylori, etc. Like that's what we're talking about when we're saying the root cause. And I don't think we're on the same page. And they can say that they're answering these questions when really they're not. They're giving excuses for why their weird bullshit should be a treatment. And because the stuff that an actual internist is going to do, a chiropractor cannot do within their scope. So they can't prescribe PPIs or H2 blockers, I don't think. They can't do an upper endoscopy. They can't do these other things that a medical doctor would do to actually rule out these causes of reflux. So yeah, I'm on the same page to an extent, but I don't think that I think they're intentionally blurring the lines here again. And they say IBS is a starting diagnosis. No, IBS is a legitimate diagnosis. It's a functional issue. Maybe I'll do a whole episode on that. Painful irregular periods are not fixed by prescribing birth control pill or synthetic hormones. My God, I hate when they get into OBGYN claims because the human body is shit. And the menstrual cycle is absolute shit. And yeah, there are some reasons that are unnatural that cause painful irregular periods, such as endometriosis, endocrine issues. There's a variety of things that could cause irregular periods and painful periods. And yeah, I absolutely think they should be looked into. But birth control is a starting place for a lot of people, and can, like, if you're in so much pain that you can't go to work and a birth control pill is going to help regulate your cycle a bit more, sure, yeah, do the extra diagnosis absolutely on top of that, but also the birth control pill is important. Synthetic hormones, if someone has a pituitary issue or an adrenal issue or an ovarian issue where they can't make their own hormones, like if someone has ovarian atrophy and they can't produce estrogen, then prescribing estrogen is the cause, like it is the solution. Sometimes synthetic hormones are the correct answer. But it's not a good answer for them because they can't legally prescribe hormones, so they don't want you to use that answer. No, but there are many things at play here. And here's something funny too, because they're claiming to be able to do, like, this last complaint that they list is an OBGYN complaint. And I mentioned at the beginning that a big difference between internal medicine and other specialties of medicine is that they are not trained in OBGYN. They can do some things, like outpatient, like, okay, some they might be able to do a pap smear or something outpatient, but like they are not experts in OBGYN. Even family medicine gets more training on OBGYN than internists do. So they're claiming to be internists, but aren't even getting the specialty right. And something interesting too, like here, let me pull up the other eligibility from the American Board of Chiropractic Internists, because something really, really scary showed up when you look at, and it's funny because I can't, oh, we're getting a 404 not found error there. I wonder if, because I had this page pulled up and I want to read this. That's the exam schedule. But there was on their page that I saw. I had it up this morning, so it does exist. But on their class page, they talk about what some of the things that they teach during this course, and or no, maybe it was on the testing, because yeah, no, it was on the testing page. That's why. Okay, because it talks about the different stations that they have to complete to have this test, to be certified as a chiropractic internist. So here, this scares me, because if you're going to test somebody, you're probably going to test them on procedures that they are trained to perform and that you want them, that they're going to be using in their practice. And I want you to tell me, um, would any of you go to a chiropractor for male or female examinations, which kind of implies genital exams, that implies pap smears, that implies cervical exams, it implies prostate exams? Would you trust your chiropractor to do a genital exam on you? I would not. I think that's really scary that they think that they're doing this. And also, internists don't really do this. This is more family medicine, OBGYN, and urology more are focused on this. The fact that they're being tested on their certification exam to do these is scary to me. And this could lead to a whole lot of other issues as well. But on the subject as well of misleading language, there's also a board of chiropractic neurology, which is kind of doing the same thing that this board of chiropractic internists is doing, but with neurology, which is even scarier for me, because neurologists treat strokes. And imagine you're a person, and you suddenly have numbness in your arm, numbness in your face. Your half your face stops working. You start slurring your speech, and you're probably having a stroke. All right, so imagine you're looking for, well, even let's because I think most people could recognize, hey, you need to go to the ER for a stroke that's happening right now. So let's take a bit more of a nuanced angle to this. A TIA, I cannot talk. A TIA, a transient ischemic attack. So a stroke, this is often referred to as mini strokes, which is not exactly a correct term. It's a colloquialism used to communicate what a TIA is to a patient. Yes, we got a fast exam in the side chat. I appreciate that. But if someone has a TIA, they had a stroke momentarily, that resolved. So you had a blood clot that got stuck, and then something happened. It maybe got dislodged again and moved out of the way, and now your symptoms are resolved. You're not out of the woods with a TIA. Even if you had the symptoms momentarily and you don't anymore, you still should go to the hospital to be evaluated, because the likelihood of you having a full-on stroke after a TIA is pretty high, right? So we need to evaluate you for risk factors, and there are things that can be done with medication to help reduce your risk in the future of having a stroke. So you need to be evaluated. So let's say somebody had, if somebody had this stuff, um, like they had the slurred speech, the arm droop, the facial droop, and that went away. And they said, oh, well, my chiropractor is a neurologist. And they go to see this chiropractor who claims to be a neurologist and says, yeah, no, you're not having any of these symptoms right now. You're fine. I'm going to give you an adjustment and send you home. And then that person goes home and they have a stroke later that day. Reasonably, we could say that if this person had gone to the emergency department, as per the guidelines of what you should do for someone with a TIA, that could have prevented somebody from having the stroke, could have prevented physical disability, could have prevented death. So is it benign to just have somebody that calls himself a neurologist, but only treats, sciatica? It's not benign. I don't think it's benign because of the blurring of the lines to where if somebody's having an emergency, they don't know what to do and they cannot appropriately treat it. But here's a website that I want to share with you. And yeah, doing adjustments on babies is absolutely scary and inappropriate. Nobody should be doing that. But I want to show you a website. This is a chiropractic neurologist. But I want you to look at this and tell me if you think this is misleading or not. So look at the top here. I'm going to zoom in a little bit. Look at his little logo at the top. Dr. Greg Malakoff, chiropractor / neurologist, board certified. This is scary because he goes on in his credentials here to specify that he has a diploma with the American Chiropractic Neurological Board. So he discloses that he is a chiropractor, which technically means that he's free from lawsuits if you called him out on this, because he can say, well, but I specified my credentials. I in no way said I was a medical doctor or a DO neurologist. So he can get away with this. But this logo, chiropractor / neurologist, if I saw this, and when I did see this for the first time, I thought that this was a person who was a chiropractor, went to chiropractic school, was licensed at that, and also went to med school and did a residency in neurology. I was under the impression that this person had 2 degrees. And they don't. They do not have a medical doctorate degree or a DO degree. They don't have, because in the US, an MD and a DO are equivalent. He doesn't have either one of those, just a chiropractic degree, but says the board certified neurologist, which is scary, but he's referring to this board certification through the American Chiropractic Neurological Board. So it sounds like to me, the fact that we have this chiropractic neurological board is scary, and they should not be able to do this, because I honestly think that neurology, like neurologist, internist, physician, should be protected titles. You should not be allowed to use those titles without having the actual license to practice medicine in that specialty. And also, this person, so this is one here that could actually be possibly grounds for lawsuit, is the claim of sports injury physician, because a physician implies medical doctor or DO. That's what it implies. Which you can sometimes get around that. I've seen, like, as we talked about before, chiropractic physician, which again, I think is too far. They should not be allowed to have that title, but they'll get away with it by qualifying it as the chiropractic physician. But him saying that he's a sports injury physician clearly blurs the line between him and a medical doctor. So I think he should not be allowed to say this. But they do because lobbying. Lobbying is the answer to do whatever you want and not have responsibility for doing whatever you want. And he's got lots of some embryology to better understand your pain. Oh my god. Okay, this guy's a mess. Um, this guy's an absolute mess. So I was B was the chiropractor Larry Nasser. So Larry Nasser isn't a chiropractor, which is scary because Larry Nasser is a DO. He is a family medicine DO with a subspecialty in sports medicine, which is really, really scary. And I mean, he's just evidence that any doctor of any stripe can be an absolute shithead and terrible human. Having a doctorate in medicine or osteopathic medicine does not make you a good person at all. And we see plenty of evidence of that. Yeah, such gatekeeping. Why can't Rob down the street sell surgery discount packs in their garage? Yeah, no, I'm just discriminating. I'm discriminating against people who just want to practice alternative medicine. Um, I was going to spend some time today talking about the difference between the American College of Pediatricians and the American Academy of Pediatrics. Um, I think I'm gonna make that a separate episode. I think maybe next week we'll talk about that because we're running out of time here for this one, and I do want to have the after show today. Um, but I mean, as a preview of that episode, basically the American College of Pediatricians is a hate group disguised as a medical doctor group and it advocates uh against trans care, against uh against abortion, against a lot of things. So and it is a Christian group as well, I believe. So we'll talk about them next week and we'll devote probably an entire episode to that. So that's what's coming in the near future. Uh Other things that are going on. Let's see. What do we have coming up? I'm not on any shows tomorrow. Um, I don't know the next time I'm on Talk Heathen. I think I'm on Talk Heathen next. I might no, not this week, not tomorrow, but the week after I think I'm on. So stop by for that. And we have trivia night on Twitch this upcoming Friday at 9:30 p.m. Eastern time. Medical Myths again on Saturday at 3 p.m. Eastern time. And then I'm not sure what else I got going on. I think next Sunday we also have Rhyme of the Frost Maiden on Nat One Hero. So stop by there. Did I find out anything about the Tylenol thing? DM me because I don't remember. I don't remember our conversation on that. And then after this, we're back with the after show, and I'm very excited to be doing an after show today. We're ending this show a little bit early, so I'll probably head over there a bit early as well. And we'll have some fun, hang out. I don't know if Phoebe's gonna be there. I'm guessing Phoebe might be there if she's in my side chat right now. But if you are a patron or a channel member, or if you are a Twitch subscriber, so if you in any way financially support the channel, I can't thank you enough. So please stop by the after show to hang out. And to thank our lovely, lovely patrons, we have Regios, Jody L, Pharmacy Sabrina, Ellipsis, Tons of Mice, Steve Ferris. Oh man, I forgot to add, I have a new one. I have a new patron as well that I forgot to add to my form. I deeply apologize. Our newest patron is Jedi Indiana Jones. Thank you for your support as well. I'm going to add you to the list as soon as this episode is over. and Haney Paul and SG. And thank you to our channel members, Rebus Wind and Lilypad LA. I could not do this without all of you supporting the channel. And thank you all for stopping in. I'll see you all in the next one.